We are live, ma'am.
Good evening, everyone. I welcome all of you in today's Sjogren's awareness program. Myself, Dr. Dhanashree, I'm a resident rheumatologist in Chandra Hospital under Dr. Chandrasekhar. So today, I'll be talking about understanding the Sjogren syndrome. Is it just beyond dry eyes and dry mouth? We need to think beyond that also. So this is an awareness initiative I have brought for you guys. Uh, yeah, as we know, Sjogren's is one autoimmune disorder, but from where the this Sjogren name came, it was basically a Swedish ophthalmologist, Henrik Samuel Conrad Sjogren, who investigated this thoroughly and discovered terminology called as keratoconjunctivitis sicca. And so the name Sjogren's came, which we know nowadays. So, what is Sjogren syndrome? Is it just a dryness of eyes and mouth? We'll just go through. So, basically, Sjogren's is of two types: primary Sjogren's and secondary. Primary, when patient has symptoms related with the Sjogren's, and secondary when it is associated with other secondary autoimmune disorders. So basically, this is a chronic autoimmune disorder. That means your own immunity is trying to attack your own cells, and they're trying to destroy the glands. But along with that glands, it will be affecting other organs like skin, nose, kidneys, blood vessels, lungs, liver, pancreas, brain, and so on. So after affecting this, they'll be producing some symptoms. We'll just quickly revise the epidemiology. It is the second most common rheumatic autoimmune disorder after the rheumatoid arthritis. Though there are no geological differences in the rates, it has been reported in all areas of the world. So depending on the criteria, its prevalence is between 5 lakh to 2 CR patients in US, and average age of onset is 40 to 60 years, where 9 out of 10 patients of Sjogren syndrome are found to have women. Uh, clinical features differs usually into two. One is glandular, that is exocrine dysfunction, and other is extraglandular or systemic manifestation. We'll see the glandular manifestation. That means it is affecting gland. Your own immunity is trying to attack the glands. Glands, as in it can be salivary glands, it can be your glands in the eyes, it can be other sweating glands also. So after their destruction or after attack on them, it will be producing dry skin with the accompanying pruritus. Itching patient can have dryness of the upper respiratory tract. There can be dry nasal mucosa, zero trachea, that you can feel the dryness in your trachea also. And the term bronchitis sicca, that means you feel dryness in your chest or lungs. There can be chronic dry cough, shortness of breath, dyspareunia because of the destruction of lubricative vaginal glands. We'll quickly revise the eye symptom. So the term very classically called as keratoconjunctivitis sicca, sicca syndrome. It is significant dryness in your eyes. It can be just an irritation or uncomfort in the eyes, and later on there can be ocular dryness. Patient doesn't have sufficient tear production. There is persistent dryness, which will be aggravating after and other insults also. And ultimately, obviously, there are no tears, there is no lubrication that can be leading to the corneal injuries. So we doctors do a bedside test called as Schummer test, as we can see. Your doctor will be putting one small slip, this small paper in your eyes, and we measure the dryness or the amount of tears. Coming to the salivary glands, usually oral manifestations can be there than salivary gland enlargement. Whenever the salivary gland enlargement is there, it is usually bilateral. Glands are firm to the palpation, and patient may not have symptoms of salivary gland enlargement, but there can be associated oral dryness, and that dryness will be to an extent that patient may find difficulty in speaking, repeated fluid intake will be there, and at times patient can have difficulty in digestion of the food. There can be sore mouth, persistent sore mouth, and uncomfortable sensation in the mouth will be there. Obviously, there is no saliva or there is lack of saliva in the mouth. This will lead to the repeated oral infection. Patient can have dental caries and fungal infections, which will produce a pseudomembrane and erythematous mucosal lesions. There can be fissured tongue. This fissured tongue it looks like this, and atrophy of filiform papillae. There are filiform papillae and angular cheilitis that can be lip soreness at the corners. So there are few tests to diagnose this, like xylography, whether we can actually look for the glands and do the imaging. And one more test, salivary pool test, uh, which is shown in this diagram, where we look for the amount of saliva actually patient is producing. But is it enough to say that patient has Sjogren's if these symptoms are there? No, there can be other symptoms like constitutional symptoms. Yeah, fatigue will be there. Patient can have non-specific muscle pain, but there can be other personality traits also which can be leading to depression, and sometimes patient also have brain fog. There are some musculoskeletal manifestations seen with the Sjogren's. Patient may have joint pain. Sometimes there will be joint swelling also, which we called as arthritis. And usually it is seen in finger, wrist, and ankles, but we cannot deny the involvement of shoulder, hips, and knees. Uh, After some time, after few years, there are hand deformities which we clinically called as Jacquard's arthropathy, but usually there is absence of erosions. We'll see how the Sjogren's can affect the lungs. Usually, as I said, there can be Zika symptoms also, but peribronchial and peribronchial mononuclear inflammation can be seen. And usually, when the doctor asks you for the pulmonary function test, usually it's seen as a small airway obstructive pattern. Patient having the symptoms related to the lungs like dry cough, shortness of breath on exertion. And usually, when the doctor asks for CT scan of your lung, it shows the thickened bronchial wall. There can be pure interstitial involvement also, but it is um, very less oftenly seen. And what we commonly see is lymphocytic interstitial pneumonia, which is characterized by thin wall cyst on imaging. And also there can be lymphocytic bronchiolitis, but manifestations are usually rare. Kidneys, yes, involves the kidneys also. It is having subclinical course, and interstitial nephritis, which shows that lymphocytic infiltration around the renal tubular cells can be seen. Patient can have distal renal tubular acidosis, which is characterized by hypokalemia, low specific gravity, alkaline pH of the urine, and nephrocalcinosis is also common. And chronic course, there can be mild renal compromise also. But is it affecting the other organs also? Yes. Neurologically, we can see peripheral neuropathy. Usually, it is sensory motor neuropathy. In that, also, sensory neuropathy is more common. Some patients can develop symptoms of NMO, that is neuromyelitis optica, and white matter disease can also be seen. Skin, yeah, it affects the skin. Usually, it causes the inflammation of blood vessels of skin, that is called as vasculitis, as you can see, and there can be some erythema also. This picture is showing this. Yeah, subacute cutaneous lupus can be also seen in skin. Coming to the endocrine, yeah, it has good, few number of patients are associated with the autoimmune thyroiditis. Liver, yes, some patients have underlying, or there can be association with primary biliary cirrhosis and autoimmune hepatitis. Blood, yes, in blood we can see leukopenia, that is less count of the white blood cells, anemia, low hemoglobin, thrombocytopenia, hypergammaglobulinemia, monoclonal gammopathies can be seen. As I said, that Sjogren's can affect your brain also, or it can aggravate the underlying personality traits also that can lead to some depressive signs. Also, in few studies, we could find out that Sjogren's patients have increased rates of neuroticism, psychoticism, obsessiveness, hypochondriasis, paranoid nature, somatization, obsessive compulsive symptoms. Patient usually have insomnias or sleep disturbances, and also patient can face the defective coping strategies also. Does it affect the lymphoproliferative organs? Yes. There are some associations seen with the non-Hodgkin's lymphoma. Uh, though the non-Hodgkin lymphoma is it's not very classic in Sjogren's. It can be seen with other rheumatological conditions also, but it's seen in some association with Sjogren's. Patient can have splenomegaly, spleen can be enlarged, and there can be other lymphomas also, like maltomas, B cell lymphomas. They can be also seen in Sjogren's syndrome. As we know that Sjogren's itself is a rheumatological disease. Does it has any association with the other autoimmune diseases? Yes, as I mentioned earlier, autoimmune thyroiditis and autoimmune hepatitis, they can be associated, or Sjogren's can be associated with them. Also, there has been some association with the celiac disease, primary biliary cirrhosis, and the systemic lupus erythematosus. Almost 9 to 15% patient can have coexisting SLE with Sjogren's, and RA, along with RA, there can be overlap in 7 to 25% patient. So this is all about the Sjogren's and what we need to think beyond dry eye and dry mouth. Thank you.